We are so glad that today we are going to have a discussion entitled Addressing the Nexus of Women, Climate Change, and Health through Governance, Accountability, and Innovative Financing. This session is organized by a coalition of partners from Africa and also India, Asia, so to speak. And for us to start this session, I'm going to call upon Dr. Anjvi. Dr. Anjvi works with SEWA. She's going to come and give us the keynote address. Dr. Anjvi, the floor is yours. Give her a clap.
Namaste and greetings to everyone. I'm Dr. Rajvi and today I stand here to represent the 2.5 million members. Established by Ilaben Bhatt in 1972, SEWA is a national trade union of marginal women workers from the informal sector economy and is functional across 18 states and 7 South Asian countries. Our two broad goals are full employment and self-reliance. And to fulfill those, we have 4 key pillars that are organizing, capacity building, capital formation, and social security. Our founder, Ilaben Bhatt, always said that to be poor is to be vulnerable. The condition of being poor or being self-employed and being a woman are all distinct, yet they are very much interrelated to the state of vulnerability, and poverty makes them one become a chronic victim of forces beyond one's control, especially the climate change. And presently, this is the plight of all the members that belong to the informal sector. The imminent climate emergency is manifesting itself through extreme weather events across the world. Communities that are often adversely impacted are the poor and the marginal sector workers, whose voices are often left unheard. These lives are woven into the very fabric of our society, yet their voices are left unheard. The disproportionate impacts of climate change are threatening to engulf their very existence. And the resilience that these members show against any given climate shock is admirable, but the problem they face is that they do not have access to ample resources, and hence the issue. The impacts of climate change on these marginal sector women are multifaceted. The climate change not only impacts their health, but it impacts their livelihoods, the energy consumption, their mental health, everything. So today I'll focus only on 2 key impacts. One is health and one is livelihoods. During one of the recent surveys that were carried out at SEWA, about more than 90% members stated that their livelihoods are adversely impacted. And to get to know the exact scale, we asked them that by how many % does this get decrease? To that, they said that it is about 30 to 50%. And the reasons for these are varied. Some of them said that their work efficiency decreases, they have to compromise on their working hours. They suffer from spoilage of goods, spoilage of food. And very often there's supply chain disruption in cases of, say, unseasonal rains or floods or heavy rains. Very often their vending sites close down. And these impacts on livelihoods very often get compounded because of the impact on health. So during the peak heat days, members suffer from various heat-related illnesses. They feel dizzy. Members who function in direct exposure to heat are often susceptible to various dermatological issues because be it salt pan workers or construction workers or street vendors, they function under the direct scorching heat and they cannot handle those metal tools all by bare hands. So they get blisters, but yet they are forced to work because they are daily wage workers. Lack of potable water makes them susceptible to various diseases. Additionally, with no water, many members stated, especially in the salt pans, that they cannot even cook 2 square meals a day. This pushes them into a cycle of malnutrition. And last year there was a case wherein one of the members in urban areas had to suffer an abortion because of dehydration. waste recyclers who work at dump sites are exposed to the noxious fumes and suffer from respiratory illnesses. So, and last but not the least, this leads to another cascade of illnesses which include mental health. Many women become more susceptible to gender-based violence. There's an increased rate in substance abuse. During our grassroots conversations, members stated that initially we were not used to chewing tobacco, but now we have to because we have to kill our hunger. The food that we have gets spoiled when we are at the work site because we don't have proper storage. Or there were cases that because of loss of livelihoods, they cannot afford to cook or get raw material for getting those 2 square meals a day. And hence, now we have resorted to chewing tobacco. So it is important for us to understand that for these marginal workers, be it women or be it the youth or children, the problem is that health is their primary asset. And for poor women, any damage to health or any adverse impact on health is a very critical determinant of their livelihood. Very often what happens is they do not have enough savings or enough money on hand to go seek care at the hospital, and they have to often choose between debt and death. And the out-of-pocket expenditure amplifies their loss of livelihood, leading them and pushing them into the vicious cycle of poverty. So keeping all these things in mind, Seva, to be precise, 2.5 million members at Seva have launched a campaign called the Swachh Akash campaign, and which means clear skies, the Clear Skies campaign, and it aims to make the surrounding and neighboring areas clean, green, and for this, like towards the end of this campaign, we want to ensure that clean environment, clean sky is their fundamental right and everybody should get it. To give a brief introduction to what the Swachh Akash campaign is, I would like to share a short video.
During our 50 years journey of organizing the women workers in the informal economy, we have faced so many crises: political crisis, social crisis, and economic crisis. So collective organized strength is our asset, and Hum Sab Ek Hai is our value. And it is only through this we are able to overcome such crises and challenges. So during our 50-year celebration, our founder Ila Ben and 2.5 million members of Seva emphasized to focus on the years to come, the generations to come, and the challenges to come. I very clearly remember that Ila Ben called me once telling, "Jyoti, let us clean our sky," because access to clean and healthy environment is a fundamental right, not for just humanity, but all life on earth. And that was the paradigm moment.
આપણા વાતાવરણમાં દિવસે ને દિવસે બદલાવ આવી રહ્યા છે અને તેની ગંભીર અસરો આપણા કામદારો અને શ્રમજીવીના રોજગાર અને જીવન પર વ્યાપક રીતે પડી રહી છે. પણ શું તેનાથી આપણે ચૂપચાપ બેસી રહેવાનું, આ બધી અસરો ભોગવ્યા કરવાની અને બીજા કોઈની મદદની રાહ જોવાની?
આપણે ઘણી બધી સમસ્યાઓને પડકારોનો સામનો કર્યો છે, એ પછી આપણી હોય, ગામની હોય કે દેશની હોય. હમ સબ એક હે એ સેવાનો જ નારો નહીં, પણ એના ગુણ અને મૂલ્ય છે. એકતા, સમાનતા અને સંગઠિતતાનો પડકો છે.
આપણા ઇલાબેન કહીને ગયા છે, હમ સબ એક હે. એ મૂલ્યથી માત્ર નાત, જાત, ધર્મ, આર્થિક અસમાનતા જ નહીં, પણ પૃથ્વી પરના પ્રત્યેક જીવો વચ્ચે સમાનતા લાવવા તરફ પગલા ભરીશું.
આપણે સર્જેલી કુદરતી અસમાનતા આપણે સંબળ વડે જ દૂર કરવાની છે. આપણે શ્રમજીવી છે તો શું થઈ ગયું? આપણા દરેકનો આ પ્રશ્ન છે. એટલે જ આપણે સ્વચ્છ આકાશની ઝુંબેશ શરૂ કરી છે. સ્વસ્થ પર્યાવરણ અને સ્વચ્છ આકાશ એ પ્રત્યેક જીવનો મૂળભૂત અધિકાર છે.
So that is what Swachh Akash campaign for Seva is. Now moving on to today's topic, that is accountability, governance and financing with reference to health and climate change. Three things are very crucial. Point one, women at the front line of climate change and as a key part of any given decision-making process. Second is the community ownership with a bottoms-up approach. If any given intervention is designed with community members as a part of it, it'll become very easy to scale it up. And last but not the least is data. In order to get to the bottom of the situation and scale up the interventions which are actually impactful, the need of the hour is to have data in place. Presently, there's very little information on how temperatures are being calculated at low resolution and how they actually impact members' health, their habitat, and what are the other parameters. For example, there might be cases where in addition to the high temperature, it is also the humidity that is playing a crucial role and how it impacts their ability to function. So in order to get to know how exactly this functions, Seva piloted a small study this year, and it was a sensor study wherein eye button sensors were used along with biosensors, which the biosensors measured their heart rate and body temperatures, whereas the eye button sensors were used to measure the temperature and the humidity. So these sensors were placed at their workstations and their residences. And towards the end of the study, what we found were that the recorded temperatures were notably higher by 4 to 7 degrees Celsius in comparison to the recorded satellite data. And second one was that the temperatures remained to tend warmer even in the evenings. For example, if the weather station indicates that there is a drop from 40s to 20s in the evening, but the indoor locations would still show a lesser amount of drop, keeping them more susceptible to heat and humidity indoors. So going down the lane, Seva plans to further scale up and develop a heat health algorithm by scaling up this study. The second one that we piloted this year was with the Adrian Arsh Rockefeller Foundation, and that was the Extreme Heat Income Microinsurance. The pilot study covered 21,000 members across 8 trades and 5 districts in Gujarat. And the product was structured in a manner that if the trigger hit a specific set temperature, the payout would directly get deposited to the member's account. So the payout would serve two purposes. Purpose one was it will act as a safety net. In case the member is not able to go out and work in these harsh weather conditions, they don't have to suffer a huge loss. Plus, in case if they fall ill or have to incur any medical expenses, the amount provided would act as a support to them. In addition to this, the program also included a procurement of various wraparound interventions, including cool boxes, solar lamps, which decreased their exposure to heat. Or, for example, these solar lamps help these members prolong their work hours, so they wouldn't suffer drastic loss of incomes. And towards the end of the pilot, we were not only able to build a social safety net for these members, but it also included financial inclusion for many. Because having financial inclusion or having access to financial services is crucial for any given resilience building process. And last but not the least, many Seva members, almost all the Seva members, they say that we do not want charity. We want a helping hand so that we can get work that is productive, sustainable, and ensures dignity. So for that, Seva has established a global climate resilience fund, which is a financing facility and is a pool of blended finance. And this pool of blended finance will help them get access to various resilient building tools, adaptation mitigation measures, and secure their livelihoods by helping them deep dive into generating green livelihoods. So I would like to end by saying that for poor women, innovation is their survival or coping strategy. It is not a luxury for them. For their daily work, they need to continuously innovate and have new things added to their skills, their tools, their function, and use it for further research. Therefore, there is need to include these poor women in climate adaptation and mitigation process, which they are already doing. All we need to do is provide them with enough resources. And before I jump onto the panel, I would like to quote Ila Bendan. We should create an economy where we nurture and support each other. And she called it the economy of nurturance. The message that the theory wishes to convey is that create a world where members are not working towards snatching away each other's opportunity or livelihoods, but together are making efforts to create a world that is respectable, resilient, and has access to sustainable livelihood opportunities. Thank you.
Thank you. Thank you so much, Rajvi, for setting the pace. Rajvi has painted a very good picture. First of all, we know the problem. The problem is that climate change is affecting livelihoods and it's also affecting health. So you painted that very well. And you also told us that there's no honor in being poor. And so for that case, SEWA has moved forward to implement the clear sky strategy. So that's so nice, and you have a couple of approaches and tools, methods which we are using to make that functional. Now, I want us to move forward, and I'm so happy that we have a distinguished set of panelists who are going to help us to dive a little bit deeper into some key issues. When Rajvi was speaking and just listening to the conversations which were going on when we were preparing, it is so clear that we wanted to have a deep dive into understanding the connections between climate change and health and how to connect that directly with the issues of livelihoods, right? Then the second thing was to really reflect around elements of accountability. How do we ensure that the social accountability mechanisms, how do we bring on board stakeholders and ensure that all of us actually walk a journey which we can commit to transformation of the communities that we work for. And lastly, it's all about exploring the innovations, the process innovations, the products, whether it is solarization and all that. So for us to get into that, allow me to first of all ask Rajvi to come to the panel. Please take the second seat over there. Yeah, and then allow me to invite Sionmi, who is coming from Group of Fund. Please give a clap as they are coming. Sionmi, you can take the other seat. Yeah, so that I'll sit here so that I can see all of you. Yeah. Okay, super. Good. Sionmi works with the Group of Fund. She is the advisor on climate change and health, and so it's so nice to have Sionmi here. She's going to send some light around how to address the nexus between climate change and health. And then we are so lucky that we have a youth, and that is Sogun. Sogun, are you here? Ah, very well. Welcome, Sogun. A clap for Sogun. And then Sewa works with the grassroots organizations, right? And so I've got Parma with us here. So Parma, please. Yeah? Yeah. Thank you so much for spelling that one. Yeah, very good. You can have a seat here. Let me see. Am I balancing the panel? You can sit near Sogun. You can go there? Okay, very nice. Yeah. Well arranged. And then I do have Dr. Ndina. Dr. Ndina works with the Yango. And the Yango is the official, one of the official youth representatives under UNFCCC. Do we have Dr. Ndina here? She's not able to make it. Yeah, but you'll be able to speak about. Thank you, Palma. Okay, and then, yeah, so that's it. And myself from Amref Health Africa. So the way we are going to do our panel, I'll take a seat, but I'm going to pose. Sorry? Sorry. Oh my God. Let me see. Did I miss out on you? Sorry, let me just check again. And I'm really so sorry. Nidhi. Oh my God, I'm so sorry. Nidhi, you're so much welcome. And Nidhi comes from Ash Rock, yeah? Yeah, so sorry for missing out on you in the initial introduction. So as I was saying, I'll pose a couple of questions. But as you speak, please take the opportunity to give us just major highlights about what your organization does as you get into the question, okay? Okay, super. So that I can easily be seen. Yeah, sure. Let me just sit over there. We can switch over. In Africa, we share. So what will happen is the microphone, when the question comes to you, then you'll be able to hand it over to the fellow discussant. Okay, so Nidhi, I'll start with you, okay? And so, Nidhi, I want you to give us some sort of reflections. I know you work very closely with the Atlantis Council. And for that case, I want to pick your thoughts about your work. First of all, in empowering women, how you have been involving them, and above all, how you connect the dots between livelihoods, health. And you can give us very clear use cases which have emerged out of your work. Over to you, Nidhi.
Thank you so much. I hope everyone can hear me. Thank you for having me on this panel. It's such a pleasure to join you all here for this important discussion. And I represent the Adrian Ash Rockefeller Foundation Resilience Center at the Atlantic Council, where we work on innovative strategies to deal with extreme heat in the most vulnerable communities across the world. Our goal is to reach 1 billion people across the world with climate resilient solutions, but focused on extreme heat. And we do that through innovative finance approaches. We work on greening opportunities. We also work on cross-sector collaboration across our projects to bring about innovative and creative solutions, because I think we've all realized, not at this COP, but maybe even a couple COPs earlier, that we have done enough damage to this world. We're not going back to a cooler world. One of our chief heat officers that we work with has very clearly said that this year was the hottest year in the world, but it's also been the coldest year in the history, that it will be the coldest year in the history as we look forward, because it's going to get hotter every single year. So we want to make sure that we address that issue. But when we think of addressing heat and when we think of vulnerable communities, we focus on women, because often in programs that we have seen developed, programs don't take into consideration the inputs and the challenges or the solutions that will benefit women in the process. We do not, as a community that produces solutions, over the last years we have started to do that now, but before we developed climate resilience projects without keeping that in mind. So as Ashtrock, when we think of programs, we think of programs with women in mind, and how do we work with them on the ground? As Rajvi mentioned, our extreme heat income insurance project that we did with them. We were trying to get inputs from the community to develop those solutions, and we would like to continue doing that. So at the nexus of heat, innovation, and financing solutions, we work on those issues, and that has a direct impact on physical and mental health on the projects that we work on. So I think that's it, yeah.
Thank you so much, Nidhi, for your submission. I know I'm going to come back to you. Yeah, so allow me to come to this side, and I'll come to Sionmi. Sionmi works for Global Fund. Of course, he's going to say a little bit more about herself. But then one thing which I would want to say, if you look at, if you look at the total health financing, I think globally it's around $50 billion, right? And Global Fund contributes about $4 billion, most of it which goes to the Global South and these developed countries. So, Sionmi, your organization really does so much around health financing and specifically looking at HIV, TB, and malaria. But I already know that you are moving forward to think about the climate change and health strategies that you need to implement to become more effective and to address the current challenge. So, Sionmi, I want to give this mic to you. And when you pick it, please speak to the Global Fund strategies, how you want to move forward and ensure that climate is embedded within the health action, and especially looking at the Global Fund. Over to you, Sionmi.
Great, there's a lot of noise out there, so I'm gonna really try to speak very loud. So first of all, thanks a lot. Huge thanks to AMREF, especially Martin, who's really spearheading climate work in AMREF for African countries. And also thanks a lot to Sewa for inviting me. We actually didn't really know each other, so it's really a good opportunity to get to know you. So first of all, my name is Sunmi. I'm originally from South Korea, like Sun and me, Sunmi. And I actually have very recently joined the fund called the Global Fund to fight HIV/AIDS, tuberculosis, and malaria, all these diseases of poverty. And this fund is based in Geneva, but I've only joined very recently, so I'm still learning about the fund. First of all, let me just share a very quick facts about this fund. The Global Fund is the largest multilateral grant provider for health, including overall health system strengthening, and obviously for disease-specific programs to eliminate malaria, HIV/AIDS, and tuberculosis. And a lot of that also funding is going to South Asian countries, including India, Bangladesh, Pakistan, but the majority of our countries also in Sub-Saharan Africa in close partnership with AMREF. As an example, Global Fund provides more or less between $4 to $5 billion a year for strengthening health systems, resilient health systems, as well as also for specific disease programs. I would like to highlight, for instance, we invest a lot in actually communities, especially community health workers, community health system strengthening. So for instance, for the upcoming 2024, 25, 26, 3 years, we're going to provide around $900 million for supporting community health workers, and a majority of them, it's 70 to 80% of community health workers across low-income and lower middle-income countries are women. So it's a huge entry point for us to support women in terms of protecting climate threats to women's child health. Maybe that's basically the fund, the big fund. Now I have joined as the Global Fund's first senior advisor on climate change and environment. So my job is basically to lead and coordinate all issues related to climate change and environment. So first of all, we're really looking at how climate change, as well as other environmental issues, are affecting human health, especially how, for instance, malaria and HIV, tuberculosis is changing. In case of malaria, and maybe you have already heard a lot about malaria, and especially in Asia, dengue, another very climate-sensitive vector-borne disease, is on the rise, and we are very concerned about that. For malaria, Global Fund provides over 65% of global financing for eradicating malaria, including diagnostics, prevention, and treatment services, particularly for children under 5, as well as maternal health-related target populations as well. And malaria, we're very concerned because we have already very clear observed impacts of the rise in malaria risk and transmission due to climate change. Malaria is very sensitive to climate factors, especially on temperature, rainfall, and humidity. And we're seeing already the geographic distribution of malaria transmission is increasing. It's, for instance, from lower to higher elevation areas in highlands of Kenya, Ethiopia. But also, very importantly, malaria is also changing, its seasonality is changing. In many countries, let's say in Sahel, as well as Central Africa, West Africa, for instance, Nigeria, we have already seen a marked seasonality when it comes to malaria, and especially children getting sick from malaria. And it has a huge link to rainfall. Tropical rainfall season is already getting longer due to climate change, and we are seeing that in a number of countries. So already malaria, which is already, a huge disease burden among children and women in much of our sub-Saharan African countries, as well as South Asia, we're really looking at the observed impacts and trying to provide additional support for our community health workers, as well as national and local health systems, to better detect and also have a anticipatory action for health systems to be able to, stand with this additional burden due to climate change. And maybe I would like to just end with the 2 other very important impacts of climate change on women's health, child health, and human health is actually climate-related disasters. And we have seen extreme heat, of course, but in much of our countries, especially if you remember Pakistan flooding, not even very long ago. So Pakistan flooding, for instance, after the floods, we have seen a almost more than a 5-fold increase in the cases of malaria incidents, malaria infection of very huge record spike after flooding. We've seen also from, Cyclone Freddy. It is, I think WMO has not declared scientifically yet. It's still trying to reach a consensus. Cyclone Freddy is the longest running tropical cyclone ever recorded in the global meteorological history. After Cyclone Freddy, Malawi, Mozambique, Madagascar, for instance, these countries have severely affected by these floods, cyclones, and cyclones often bring multiple climate hazards. Cyclone, but also coastal storms, river floods. So huge floods happened as well, and and that we have also seen a huge increase in malaria, but also displacement of people, as well as destruction, losses and damages to health, human health in terms of loss of lives, but also health systems, community health posts completely wiped out, destroyed. These losses and damages to health are already occurring in many of our countries, and we are already providing flexible funding. However, there's a huge funding shortfall in life-saving healthcare services and products already. So we really are very concerned about climate-related disasters and its impacts on health, as well as health systems. Now, finally, secondly, is on climate-induced food security. we're really concerned about climate food security and nutrition and security, really directly affecting maternal and child health. And we're really trying to work on, together with other humanitarian partners and development partners, provide healthcare services that is combined with also adequate nutrition and food security services as well. So climate-induced displacement, climate-induced food security, food crisis, and climate-related disasters that are already widespread, negative, severe impacts on health of our vulnerable communities. So that's where we are for now, but I think I'm going to continue. Let me stop here and share.
Thank you so much, Sion. Me, a clap for her. Yeah, you've painted a very nice picture about the diseases of poverty and why we should not continue that way, and why you are even attracting yourself to move a step further to think about how to integrate climate and health, yeah, and putting the community at the center. She spoke very strongly about community health systems, so let's keep that one in mind. Now, allow me to come to you, Parma. Parma, yeah, sure. Okay.
She'll answer and then I translate.
You will do that?
Yeah.
Okay, very nice. Okay. So, on behalf of Parma, Ranjvi, could you just share some, you tell her to share the experiences around practical financing instruments and how the grassroots organization which she is working with is putting women at the center and with focus on how to construct proper governance mechanisms and accountability mechanisms. Yeah? Yeah, please.
જશીબેન, માર્ટિનભાઈ પૂછે છે કે પર્યાવરણમાં આવતા જે બદલાવો છે એની સામે આપણે જે ઉપાયો કર્યા છે એ બહેનોને કેવી રીતે ફાયદાકારક છે અને કઈ દિશામાં આપણે એને વધારે સારી રીતે આગળ લઈ જઈએ જેથી કરીને આપણા જે સમુદાય છે એને વધારે ફાયદો થાય.
નમસ્તે, મારું નામ જસીબેન. હું સેવામાંથી આવું છું. સેવાનું સંગઠન 25 લાખ બહેનોનું છે. હું એક ખેડૂત બેન છું. સેવાની એજ્યુકેટિવ કમિટી મેમ્બર છું. આફાની ચેરપર્સન છું. તો આજે જે ક્લાઇમેટ ચેન્જ વિશે વાત કરી કે આપણે બધાને ખેડૂતોને જે બહેનોને જે શ્રમજીવી બહેનો છે તો એમને જે તકલીફો પડે છે કારણ કે વાતાવરણમાં ઘડીએ ઘડીએ બદલાવ આવતા હોય. ઉનાળામાં ચોમાસું ને ચોમાસામાં ઠંડી એવું એટલે ઘડીએ ઘડીએ બદલાવ આવતો હોય તો એ બદલાવની અંદર બહેનોના જીવનમાં પણ તકલીફ પડે છે, બહેનોની રોજગારી ઉપર પણ તકલીફ પડે છે અને બહેનોના સ્વાસ્થ્ય ઉપર પણ તકલીફ પડે છે.
I'll translate this much. She's Jasumatiben Parmar from Ahmedabad and is a farmer by herself. She is one of the executive board members at Seva and also is a executive member at the Asian Farmers Association. So what Jasiben is saying that the impacts of climate change are multifaceted. It not only impacts their health but also livelihoods and food security, as we mentioned. Recently, what they have been observing is that the irregular precipitation patterns, that while the farmers and marginal members are waiting for rains, they have to suffer for longer period of droughts and vice versa. And that impacts their harvest and yield.
બહેનોના જીવન ઉપર અસર પડે. આજે તમે હમણાં વિડીયો જોયો એમાં મીઠા કામદાર બહેનો હતા. તો એ બહેનો 8 મહિના સુધી ઉનાળામાં મીઠું પકવાને જ્યારે ચોમાસાનો વરસાદ ઓટોમેટિક કુદરતી માવઠું થઈ જાય અથવા વરસાદ થઈ જાય તો લાખો ટન મીઠું એમનું બધું નકામું જાય. એટલે બહેનોની રોજગારીનો પ્રશ્ન થાય, બહેનોની સ્વાસ્થ્ય ઉપર પણ તકલીફ થાય. એ બહેનનું કોણ? એ બહેન તો ગરીબ છે, શ્રમજીવી. એટલે એ બહેનોનું શું? એવી રીતે તે હું વાત કરું તો જે બહેનો શ્રમજીવી બહેનો કે ગરીબ બહેનો કે જેને પોતાને રહેવાનું ઘર નથી પણ એ બેન બાંધકામ કરવા જાય, બીજાનું ઘર ચણવા જાય તો એ મકાન ઉપર જ્યારે માથા ઉપર તબકડું લઈને ચડતી હોય એ વખતે બેનને 50 થી 51 ડિગ્રી ગરમી પડતી હોય તો એ બેન ઉપરથી નીચે પડે, ના પાણી હોય કે ના કશું હોય, કોઈ એનો આધાર ના હોય, નીચે પડે એટલે બેનનું તો આખું જીવન નકામું. એની આવકમાં પણ તકલીફ પડે, એના સ્વાસ્થ્ય ઉપર પણ તકલીફ પડે અને એના આર્થિક રીતે ઘરની અંદર પણ તકલીફ પડે.
So she has highlighted two examples, one of which is of a construction worker. So she mentions that when these construction workers and daily wage laborers, they ensure and construct shelters for other people, but at the same time, there's no one to look after them. So in harsh weather conditions, they are forced to work, and very often it happens that due to direct exposure to heat in high temperatures ranging from 50 to 51 degrees Celsius, members feel dizzy, and one or two of them have fell down from the scaffolding and had to either compromise on their health or lives altogether. And the second one she mentioned is of salt pan workers that we saw in the video. These salt pan workers are stationed there in the salt pans in these hard desert conditions with lack of availability of resources, and at a stretch work for 7 to 8 months. So what happens is, in case of unseasonal rains or irregular precipitation, the salt harvest that is ready to go to the subsequent process, it gets spoiled, and that leads to a loss of livelihood.
એટલે હું પણ પોતે ખેડૂત બેન છું, તો હું આ સેવાના 25 લાખ બહેનો વતી આજે વાત કરું છું કે હું એક જ ખેડૂત નથી, પણ આવા 25 લાખ બહેનો મારા બધા શ્રમજીવી છે. તો જ્યારે ચોમાસામાં આપણે ડાંગરનું કે અનાજનું ઉત્પાદન આપણે કરતા હોઈએ ત્યારે વરસાદ કુદરતી આવી જાય તો આપણે જેટલું અનાજ ઉગાડ્યું હોય એ બધું પાણીમાં પલળી જાય અથવા તો તે કોવાઈ જાય અથવા તો આપણા હાથમાં આવે નહીં. તો આવા સમયે પણ અમને પણ તકલીફ પડે છે. તો અમને પણ એવું થાય કે અમારી આવક ક્યાંથી, અમારા જીવનનું શું, અને બીજું કે અમે સારું અનાજ ખાઈ ના શકીએ, એટલે અમારા હેલ્થ ઉપર પણ એની અસર થાય છે. એક મિનિટ, હા, એટલે અમે આના માટે થઈને સ્વચ્છ આકાશ તરફ જઈ રહ્યા છીએ અને અમે એમાં પૂછવાનું કોને, પણ અમે પોતે બધું સ્વચ્છ આકાશ ઉપર જઈ રહ્યા છીએ અને તેમાં અમે બહેનોને જો સલામત રાખવા હોય, એમને ઊભા કરવા હોય આમાંથી, તો એમનું એક રોજગાર ભંડોળ હોવું જોઈએ. બીજું કે અમે બહેનોને જો પર્યાવરણમાં સારું રાખવું હોય, ચોખ્ખું રાખવું હોય, નવી જનરેશનના આપણે સારી ચોખ્ખી હવા, સારો ખોરાક આપવો હોય, તો એના માટે અમે બાયોગેસ પ્લાન્ટ કરાવીએ છીએ. બીજું કે સોલાર પ્લાન્ટ નંખાઈએ છીએ, ઉર્જાની ખેતી કરાવીએ છીએ અને પ્રાકૃતિક ખેતી તરફ બહેનોને લઈ જઈએ છીએ.
આભાર. So what Jashiben is saying is, in case of farmers, what happens is what they grow is not what they get as their food source. So because of loss of livelihoods, they have to compromise on the quality or quantity of the food that they get. And to help with all the problems that she listed, be it with the salt pan workers, construction workers, and farmers, as we saw, Seva has launched the Swachh Akash campaign. And to help, she stated two solutions. The first one was to have the livelihood resilience recovery fund in place, which is a pool of funds again, that similar to the global climate resilience fund, wherein members contribute all together, and then together it will serve as a safety net for them in case of a climate shock. It will provide them with immediate relief. They won't have to wait for long. That is one point. And second, that in order to ensure that the youth and the future generations get access to cleaner environments and clean air, Jashiben suggests that everybody and all the members should start switching to renewable sources of energy, clean and green mechanisms, which include having biogas plant or solar energy in place, which will ensure income as well as adaptation and mitigation to the climate shocks.
એક મિનિટ, એટલે હું અહીં દુબઈ, હું પણ એક ગામડાની છું અને હું અહીં દુબઈ આવી એનો મને કોઈ ગર્વ નહીં, પણ આજે અમારી શ્રમજીવી બહેનોની જે અહીંયા વાત કરી અને તમે સાંભળી એ બદલ હું બધાનો આભાર માનું છું. થેન્ક યુ.
She's saying that she is herself a marginal worker and belongs to the informal economy, and is thanking all of us that we gave her time and chance to verbalize what her thoughts are and is grateful for all of us.
For sure. Another clap. Because this is very foundational, there's nothing so important like having grassroots voices coming to the center and to the table. So thank you so much, Parma, for that. Yeah, so now I'll turn to Sogun. And when you see the youth, you know that's where the future is, right? Some of us who are in the middle of life, yeah, I know you are the ones who are coming to take over and, give us the leadership that is going to take us to the sunset years. So I want to pick your thoughts, Sogun. And when you speak, I want you to focus on the youth initiatives, what the youths are doing. What are your aspirations? What are your ambitions when it comes to, first of all, economic empowerment? What are the gaps? What are the pain points? And what would you want us to do for you, those of us who are in positions of leadership and capacity? Over to you, Sogun.
Thank you so much. Thank you so much, everyone. And it is a pleasure and honor for me to be here. My name is Shogun. I'm a 26-year-old youth delegate from Thailand. And I'm currently co-leading a venture studio fund called KX Venture Studio, which is a $10 million venture building pre-seed fund that's focusing on leveraging technologies, including AI and blockchain, in order to come up with innovative solutions for social problems, including in healthcare, sustainability, and financial services. In addition to this, I also have been a COO of a nonprofit called Penta Medical Recycling, an initiative that repurposes medical devices from the US to developing countries, especially prosthetic limbs for amputees around the world. So throughout my involvement from a very young age, I've always been passionate about the healthcare space, and also ensuring economic equity for all, especially coming from Thailand. And I think that there's a lot of opportunities for youths to make a difference in any form. Since I was young, I was able to engage and start these initiatives, and I think that part of the reason why I was able to engage in these conversations and be able to come up with innovative ideas is because of the financing solutions that have been provided by institutions or organizations that have supported me throughout, as well as mentorship from leaders, from all these organizations. So I think that firstly, innovative financing solutions, especially for marginalized innovators and entrepreneurs, is extremely important because especially youths, we have a lot of ideas, we have a lot of, creative solutions, but then we don't have the experience, we don't have the resources, financial or professional resources in order to make our vision come to reality. And I think that part of the financing solution that needs to come is to be able to first have a good allocation of funding to make sure that there's enough to tackle different spaces and different areas of need, including in different spaces in the healthcare and climate sector. But also the distribution is extremely important as well, making sure that it reaches people across the board, especially local communities who might not have the existing network to tap into those sources of funding. And so I'd love to discuss with you more about these financing solutions and how we can empower youths to make a difference in these spaces. And what I want to tell adults who are in positions of power, who have the capability to fund these youths, is that there's always more that you can do to engage youths in conversations and also in initiatives, because I think that there's so much energy and there's so much willingness from the youth engagement to want to be a part of something creative and global. But then sometimes we don't have the money, but we also or the network to be able to make that difference. So I'd love to talk to you more about it, and thank you so much for having me here.
Thank you so much, Sogun. I know we have a hard stop in 10 minutes, And so what I'm going to do is I'm going to take the opportunity of asking each and every panelist to just simply summarize in like 1 minute the takeaway or the message which you want our participants to like carry home. And can I start with you, Nidhi, over there? Okay, good.
Thank you. It's been very engaging to learn about all the work that you all have been doing. I think the few takeaways that I can highlight here are: one, women need to be at the center of the decision-making process, whether it is for themselves, their communities, or a program that some of you may be starting. So keep in mind that every program needs to be crafted innovatively and keeping women at the center of it. Second is highlighting cross-sector collaboration, because we need to focus on bringing everyone together. Everyone is putting out innovative solutions. COP, you've heard so many of them, I'm sure, through events and other initiatives that have been announced. But how do we leverage different stakeholders putting out different solutions and bringing them together and elevating those so that we can scale those solutions and we don't have to keep recreating the wheel around these solutions? And I think the one thing that I would like to stress on is that we have to look at extreme heat and how it impacts health, and not just its health across the board. It is going to lead to, extreme heat is the silent killer. We don't see the impact of it flooding, or, how you see in flooding and earthquakes and other damages. It's not visual. It's underlying, and it has done more damage than all of these climate hazards put together, because it slowly affects your mental and physical health. And we heard from Sanmi about the maternal and neonatal health as well, of how it impacts it. So it's not just affecting you, it's affecting your future generations and their development. So thinking of extreme heat from that perspective and thinking of innovative finance solutions or cross-sector solutions would be key. So those are my key takeaways.
Thank you. Over to you, Ranjvi.
I'll be very precise. Point one is I totally echo to what Nidhi Ben said, but in addition to heat, to any given social net or insurance product that we create, we should include other parameters of climate change, including unseasonal rains and cyclones. That is point one. Point two, the need to have data in place. We need to have data at localized level in order to get to the bottom of the solution and scale up the effective patterns. And second, having community ownership to all the given interventions so that it becomes a smooth process and women as nurturers can take that movement forward.
Thank you. Ranjvi?
Yeah, so I think one key takeaway that I want to touch upon is to highlight how technology can really be used as a tool to increase, governance, accountability, and also innovative financing. So I think that right now, to scale the governance or accountability frameworks, I think that technology, whether it be through blockchain or AI or automation of different platforms, in order to create more interoperability of data, or allow more transparency in accounting for what impact each project has been doing, and also aggregating them or automating the way that funds are allocated to different communities, as well as being able to reach them in the first place. I think that technology is a great tool that we should explore more in order to see how we can improve the governance, accountability, and innovative financing solutions.
Thank you, Sogun. Over to you, Siona.
Thanks. Oh, I have 2 points, hopefully within 1 minute. One is, considering this nexus between women, climate, and health, really, first of all, apply the rights-based approach. And what does that mean? You know, when we talk about climate justice, environmental justice, rights to a healthy environment and stable climate for women and children, what does that mean? Right to access to information. Women, vulnerable communities should have the right to information, and then right to participate in policy as well as finance, and then right to also remedy. And we have seen a lot of cases where, you know, when we're talking about communities in our, you know, South Asia and Sub-Saharan Africa, I think it's important to look at really multiple hazards, multiple environmental and climate pressures that women and children are basically exposed to. So don't just look at extreme heat alone. There's air pollution going on, there's landslides, there's floods going on, you know, so multiple stressors, and right to remedy. A remedy meaning basically they have the right to financial compensation and other compensation, mental and political compensation to be done. So this rights-based approach when we tackle this nexus. And then secondly, we know you heard a lot, it's almost becoming a jargon, locally led solutions. Everybody's talking about community-based, locally led. What does that actually mean? Now when we look at the climate finance landscape, only, I think, you know, IIED's latest study, there's not even a very good data about it, by the way. It's only less than 10% of international climate finance is going to actually benefit locally led solutions. So then, and then within that, I think from where I'm coming from, where we're looking at the impacts of climate change on human health, locally led solutions basically really, how do we actually use and strengthen the community systems, community health systems, community systems to really manage current as well as future projected multiple impacts of climate change and other environmental stressors on women's health and children's health. So that's final thing, and that's really important for funding as well, finance and all in this discussion. Thanks.
Thank you. એટલે મારે બધાને હું એવું કહું છું કે આપણે સ્વચ્છ આકાશ તરફ જઈએ અને જ્યાં જંગલો ઝાડ બધું કાપી નાખ્યું તો આપણે વૃક્ષારોપણ કરાવીએ, પ્લાન્ટેશન કરાવીએ અને બહેનોને સ્વચ્છ આકાશ તરફ લઈ જઈએ અને પર્યાવરણ આપણું સુધારીએ.
So she has a simple message for all. Like we all mentioned that all the movements should be community-led. She mentions that we should take baby steps and start with things that can be done on our own. For example, we can start with planting more trees, afforestation, as a method to mitigate the increasing impacts of climate change.
Thank you so much. Yeah, just another clap for her. So, our distinguished panelists and participants, allow me to summarize. And as I summarize, I work for an organization called AMREF. We equally work with grassroots. Our vision is creating lasting health change. We work in Africa. So today, I'm so happy that Africa and Asia are coming together, not only to complain, but to offer solutions. And those solutions are so profound. The first thing which I hear very clearly is that we need to put the community at the center. So it is a bottom-up approach to doing things. And we're also very clear that if you want to address the challenges holistically, make sure that you are putting money into the pockets of the communities, and that is through livelihood initiatives. And I can see there are very nice approaches which have already been spelled out. The question is, how do we ensure that all these novel approaches are taken forward, curated, and scaled up? So that's something to really take forward. The other piece, which is very clear, is that within the entire society, there are those cohorts which are disadvantaged and which require support. And that is women and the youth. Sogun was very clear what he is requiring from us. I heard clearly that if we want to be authentic, research and evidence needs to come to the center. And at the end of the day, we are going to solve this big problem if and only if we are going to invite ourselves to address this challenge of climate change in an integrated manner. So as we close this session, we are looking forward to do something. We don't want to treat this as an event. We are going to make sure that all those lessons which have come out of this are going to be put in a paper, and a paper which challenges the status quo. So look out for whatever we are going to do, and I'm so happy that it's looking like it's intercontinental kind of an approach. So thank you so much, ladies and gentlemen. I wish to end this session here, and I ask you to give a clap to yourself and to the panelists. Thank you so much. Yeah.